As I have stated repeatedly on this channel, one of the biggest barriers that transgender adults face in being accepted by society is the fact that as much as I and people like me would like to say I support trans rights and I support the right of an adult to live in whatever way they feel is best for them, I cannot do that if in doing so it implies that I tacitly support or accept, as I'm about to show you, dangerous and irreversible medical experimentation being performed on children. And 5 to 10 years from now, or whenever it is we find out whether or not we were on the right side of history, I'm going to point people to this video because as of 2 weeks ago, two of the top medical professionals in the field of gender affirming care, Dr. Marci Bowers and Dr. Erica Anderson, both of whom are transgender adults themselves, did an interview with Abigail Shrier, the author of the, let's say, controversial book, Irreversible Damage, in which they clearly lay out what kind of horrible medical malpractice has been occurring in that field for the past 5 or so years. Here's what Marci Bowers had to say in that interview. The idea all sounded good in the very beginning. We're doing some magnificent surgeries on these kids, and I'm so proud of so many of them and their parents. But honestly, I can't sit here and tell you that they have better or even as good results. They're not as functional. I worry about their reproductive rights later. I worry about their sexual health later and ability to find intimacy. And my fear about these young children who never experience orgasm prior to undergoing surgery are going to reach adulthood and try to find intimacy and realize they don't know how to respond sexually. Here's what Dr. Erica Anderson had to say in that same interview. It is my considered opinion that due to some of the, I'll call it just sloppy healthcare work, that we're going to have more young adults who will regret having gone through this process. And when asked about what she meant by sloppy, she said rushing people through the medicalization, as you, referring to Abigail Shrier, and others have cautioned, and failure, abject failure to evaluate the mental health of someone historically in current time and to prepare them for making such a life-changing decision. Now, it's one thing to hear from top medical experts how this kind of malpractice played out or began with, but it's another thing to see it in action. And so I'm going to show you an example directly from the Journal of the American Medical Association of a study that clearly demonstrates exactly what kind of junk science has been allowed to pass as research in this field. This is a study conducted in May of 2018 around chest reconstruction in transmasculine minors and young adults. Chest reconstruction is the process of surgically removing the breasts of females who are gender dysphoric. Now, the objective of this study was to examine the amount of chest dysphoria in transmasculine youth who had chest reconstruction surgery compared to those who had not undergone this surgery. Eligible youth were 13 to 15 years old, had been assigned female at birth, and had an identified gender as something other than female. So what this study was trying to do was determine if we cut off the breasts of someone between the age of 13 and 25 who was experiencing gender dysphoria, would that be beneficial for them in the long run? And you might be thinking, why in God's name would we need a study to answer that question? And I would agree with you for the same reason that we don't need a study to determine whether or not giving cigarettes to children is a net positive for their mental health. But I'm going to show you why the situation is actually worse than that. This chart shows the age that the participants in this study were when they had their double mastectomy, their breasts removed. 17 years old, 16 years old, 15 years old, all the way down to as young as 13 years old. And so somewhere on this godforsaken earth, doctors cut off the breasts of at least two 13-year-olds because they felt that that might be a good idea for their mental health. And God knows what they were thinking in terms of like whether this is a good idea 10 years from now. But here's the most horrific and junk science part of this study. The length of time between survey and chest surgery varied from less than a year to 5 years. This means that 59 individuals, less than 2 years from getting their breast cut off, were followed up by this survey and asked, are you happy? Is your mental health good? Do you still suffer from chest dysphoria? So to put this in plain terms, a 13-year-old could have got their breasts surgically removed, and then the doctors follow up with that 13-year-old 2 years later when they're 15, when the child is still on hormone therapy and riding the highs from their hormones and still being celebrated in their new identity at school and all of those things. The doctors ask them, well, is your chest dysphoria gone? And because the child's clearly is still riding the high, says yes. The doctors then conclude, given these findings, professional guidelines and clinical practice should consider patients for chest surgery based on individual need rather than chronological age. In other words, it's okay to cut off the breasts of 13-year-olds because 2 years later, we asked them, was it the right decision? They said yes, and therefore we wrote this surgery off as a success for the rest of their life. And these dumbasses wrote down that 67 of the 68 post-surgical respondents reported no regret about undergoing the procedure. Yeah, when you ask them less than 2 years later, go on the detransition subreddit, listen to detransitioners. Often people don't realize it's a mistake until 5 to 10 years later. And so when you hear people say, well, according to studies, the regret rate for transgender surgery is very low, this is the kind of bullshit science that they're referencing. The same bullshit science that Marci Bowers and Erica Anderson both had to blow the whistle on because we are so past the point of common sense that it's ridiculous. And whether you believe me or not, the whole point of calling this out is so that we can disassociate transgender adults who are just trying to fit in and live their life and have gone through maturity and gone through puberty and can make the decisions that will affect their life in the long run from young children who cannot make decisions because their brains have not finished developing. And I don't really feel the need to justify why I'm making this video, but I do want to share with you an email that I received a week or two back from a 14-year-old transgender kid from France who appreciated my defense of transmedicalism, which is basically a complex word for saying that you believe transgender adults should be able to get surgery, but not kids. The kid said, I appreciate how you acknowledge dysphoric trans people, and I hope it becomes more normalized to distance us from the weird TikTok girls. I agree. Fuck all that shit. You can quote me when I say cis people who are trans medicalists make us feel 10 times more included than any SJW BS. And I responded to this kid's email, and I asked him, how do you feel about gender surgery being accessible to young children? And this kid said that if there was an option for him to transition medically, he would pursue it ASAP, and he'd give up his leg to be born a guy, no exaggeration. He still says, because of the fact that other kids could be at risk, and there isn't a change socially to make sure that that risk is mitigated, he still would opt for things being the same, meaning he doesn't believe kids should have access to gender reassignment surgery. So a transgender 14-year-old kid has more wherewithal than all of the doctors and the researchers who thought it was a good idea to cut off the breasts of 13-year-olds at whatever rate they're doing, and this is where we are. And so as long as this insanity continues to go on, I'm going to continue to bring it up because maybe I'm just that big of an asshole. And if that's the case, well, oh well, because someone has to have a spine to talk about this shit. So, good luck and Godspeed.